of bad things happen when you stop eating carbs. Hi, I'm Dr. Eric Westman, and welcome to my channel where I review and debunk nutritional information online. In this video, we're going to hear from an influencer, physician, used to be carnivore, keto, now is kind of against it for various reasons, and we're going to see some of those reasons. And it's going to bring up many different issues that I want to get into that I haven't really talked about before. Be sure to wait till the end where I give my final thoughts.
There is evidence in humans that ketogenic diets, that is limitation of carbohydrates, leads to increased stress hormones, that is cortisol, epinephrine, also known as adrenaline, and glucagon. Now, the cortisol and epinephrine may attenuate long-term, but glucagon is always going to be elevated when you are low carb or limiting your carbohydrates, and glucagon is clearly a stress hormone in humans. There are multiple studies showing that adding carbohydrates to athletes or to humans that are not doing intense exercise improves all sorts of metrics, improves cortisol metrics, improves recovery from exercise, or improves thyroid hormones, this sort of essential thermostat that your body has that tells your body where the metabolic rate should be. And guess what? If you want to stay lean, if you want to be healthy and have energy and feel good and have libido, or if you want to lose weight, you want your body's metabolism to work well. You want your thyroid to be moving your body's thermostat to the highest level possible at all time.
Well, you have to admire his enthusiasm, the way he speaks about things. So Dr. Saladino, this is where I'm going to get a little, I should say, specific about the profession and who the influencer is, what background they have, what information they're bringing to bear on their judgment. And so within the field of medicine, some doctors are trained in physiology, biochemistry, and use that in their practice. Some don't. And some doctors get really rigorous kind of training and then residency training so that they see what they have been taught in practice. Or they create a clinic that is using what they have been taught in practice. Other influencers may or may not even be physicians, and that might be okay if they have their own personal story and they're honest about that, and then they expand their story to other people. That may be a legitimate source of information too. But here, I'm afraid that Dr. Saladino, I found his history interesting in that he was carnivore, wrote a book about it, has done keto, been talking about that, got a lot of people into the low-carb keto space, and then switched or added back some carbs because his own idea of how he was doing was better when he ate carbs. That's great. So yeah, to then say that that's what everyone should do is a problem. So one person's experience is fine. But now here's where we kind of get into the weeds here. There are some blood tests that are going to look different, even in healthy people, even though they look different or they're interpreted badly in another context. For example, cholesterol levels. Cholesterol levels can look really bad if you do certain diets and doctors say it's bad, when it might not be bad. It's just a different type of metabolism. So I remember Dr. Saladino was checking his own blood and was worried about different levels of things changing and add back carbs, and he feels better. That's great. You might be surprised that in my book, End Your Carb Confusion, I have 3 different levels of carbs. It's not just a keto book. And I don't say if you don't do keto, then doing this higher level of carbs is bad or it's good, or there are a lot of ways to be healthy. So let's look at the evidence that he presents about the unhealthfulness or danger of a keto diet with the real critical appraisal eye that might not be so obvious, but it should be. Hey everyone, I've got something exciting to share. If you love the content on this channel, our YouTube membership is the perfect way to take your experience to the next level. As a member, you'll get early access to new videos, be the first to see fresh tips and insights. Plus, twice a month, I'll be hosting exclusive live Q&A sessions where you can ask me your keto questions and get personalized advice. You'll also get shout-outs for recommending videos to the community, just our way of saying thanks for helping spread the word. So, if you want early content, direct access to me, and a more personalized experience, hit that join button below and become a member today. Looking forward to seeing you in our live sessions.
So consider some of these downsides of ketogenic diets. Here's a paper: a short-term ketogenic diet impairs markers of bone health. Markers of bone remodeling were impaired after short-term low-carb, high-fat diet.
So 3.5 weeks. So the classic metaphor is, let's say you do a study and you're getting sedentary people into exercise. So you're ramping it up and you ask people how they're feeling at 3.5 weeks. They've never exercised before, and now you're introducing a program. Well, they feel terrible. They're sore. They're wondering why they're doing this. And yet we know in the long run, exercise will be beneficial for them, probably. There's some people who can't exercise, so we can't even go down that path. But so the idea that a 3.5 week study means anything is fallacious, really. I mean, unless there was some death and dying sort of thing. So there is a term called keto adaptation. When you cut carbs out, your body changes to fat burning, and there's an adaptation period, which can go on for 6 months if you're trying to maximize your muscle function, for example. So, short-term study, not good evidence.
Changes in the thyroid hormonal status in patients receiving ketogenic diet due to intractable epilepsy.
So I don't know if you're new to this keto world. You may not know this. If you've listened to me before, forgive me for repeating it. The ketogenic diet for epilepsy is different than what I teach. It's much more extreme, and it often is used in children who are not healthy for other reasons. They have seizures and sometimes other serious metabolic issues going on. So using a study of children on the ketogenic diet for epilepsy doesn't apply to Dr. Saladino or any adult doing a more loose or more flexible kind of dietary approach, which is the keto diet for type 2 diabetes reversal or obesity or metabolic syndrome reversal. So this diet doesn't count. So this study doesn't count.
Here's another study showing that the thyroid hormones are negatively affected by ketogenic diets. This is done in children. This is done in patients receiving a ketogenic diet due to epilepsy. The conclusions: the ketogenic diet caused thyroid malfunction and L-thyroxine may be required. This is the first report documenting the effect of a ketogenic diet on thyroid function. Thyroid function should be monitored regularly in epileptic patients treated with a ketogenic diet. I would go so far as to say that anyone doing a ketogenic diet, even if that diet is working for you, should have regular checks of TSH, T4, T3, free T3, free T4, and reverse T3. I have very rarely seen optimal levels, especially of total T3 and free T3, in people doing long-term ketogenic diets, which I think is a real clear signal that our bodies thrive with carbohydrates and see carbohydrates as a signal of abundance.
So that's quite a recommendation. I've been on committees, panels, guideline programs. You don't just take one person's recommendation. Anyway, this is where I'm getting a little harsh, I'm afraid. So Dr. Saladino is saying like a policy for everyone. They should get these things checked and they've been bad. And when actually what you check in the blood may not be an adequate reflection of what's going on in the cells of the body. So this is the advanced course of reading and looking at studies, and when they look at blood and outcomes, because what's in the blood is not necessarily a great reflection of what's going on in the cells. I know it sounds crazy. So the thyroid hormone levels themselves can change, and the person can be euthyroid, we call, meaning saying that their thyroid level is fine. If someone has gone through a weight loss process, we know that the weight loss itself, regardless if it's from diet or drug or other reason, the body will turn down its metabolic rate, have a lower thyroid level, and that's a normal adaptation or response. So you would never just, and doctors do this all the time, never just look at the blood level and say you're normal thyroid or you're low thyroid without talking to the person, without asking, how do you feel? I've seen people with classic low thyroid symptoms. The blood level is normal and their doctor says you're not low thyroid. You can actually miss people with low thyroid if you just focus on the blood. So the blood levels here, I'm afraid, and Dr. Saladino probably, well, he didn't do an internal medicine kind of residency where you, or at a tertiary care hospital, even where you get and have to figure out, kind of like the TV show House on TV. It can be difficult to figure out what's going on sometimes, and the blood level itself is not a great indicator of how you're doing for several things that we're talking about here. I think the ferritin level was something that Dr. Saladino was curious and worried about. Here he talks about the glucagon level. Well, basic biochemistry tells us that if you're going to be moderating your glucose level, not by carbs coming in, so you have this constant source of glucose and you need insulin to keep it down. If you're not eating many carbohydrate, your blood level will be actually a function of the glucagon level, and it's glucagon that keeps the blood sugar up, so you don't need to eat carbohydrates. In the world of carb eaters, glucagon, that sort of effect is thought to be a stress hormone. When you don't eat carbohydrates, it's normal physiology for your body to basically have blood sugars like this because of glucagon. That's the main controller of that glucose level. So again, the biology is different, the metabolism is different. It's not necessarily bad or wrong.
You want your thyroid to work well. We know that when your thyroid is not working optimally, there are increased rates of all sorts of things, especially cardiovascular disease. What about cortisol?
So the thyroid level itself doesn't tell you that your thyroid is normal. If it's off, it doesn't necessarily mean the cells internally are abnormal or off.
Cortisol is very clearly a stress hormone that is absolutely induced when you limit carbohydrates in humans. There are studies like this one. Dietary macronutrient content alters cortisol metabolism independently of body weight changes in obese men. As you can see in the conclusions, a low carbohydrate diet alters cortisol metabolism independently of weight loss. In obese men, this enhances cortisol regeneration by 11-beta hydroxysteroid dehydrogenase 1 and reduces cortisol inactivation by A-ring reductases in liver. The authors of this study found that in obese men who were doing low carbohydrate diets, that is 4% carbohydrates, for 4 weeks, levels of cortisol were increased due to reduced inactivation and increased regeneration by an enzyme specifically known as 11-beta hydroxysteroid dehydrogenase 1. The name of that enzyme isn't important. What is important is the idea that on low carbohydrate diets, more cortisol remains in your body, at least for 4-week trials like this one, because of increased regeneration and decreased deactivation of cortisol.
4 weeks, right? So if you start up an exercise program, now we need to consider that Dr. Saladino is doing a great job of putting together what he sees as important information, but we all come at it from our own standpoint and bias and point of view. So the 4 weeks just isn't enough to say that it's bad. You've got to get through that keto adaptation period, and even then I'm arguing that we should get outcome studies. How about diabetes reversal and a little cortisol going up? So the clinical use of these programs, don't worry about this. So if you're one of my patients, you're reversing diabetes, metabolic syndrome, things like that, these are minor things. Now, if you're generally healthy, and this is Dr. Saladino's audience, I believe, where he's not worried about people coming in on insulin and things like that. And so we're kind of really fine-tuning this metabolism, which it's much more complicated, and it's more of a mosaic of things going on rather than just drilling down to these one individual markers.
That is not a good thing for humans long term. Excess cortisol leads to all sorts of issues in humans. You do not want your cortisol levels to be higher.
So what I don't understand with a lot of the influencers is this kind of fear mongering. And you don't want that. I don't understand it. It's not. You're not going to get that from me unless it's something really to be worried about, okay?
Obviously, there are some physiologic utilities to cortisol, specifically a cortisol awakening response first thing in the morning that helps wake you up. But consistently elevated cortisol levels due to stresses induced in the body by limitation of carbohydrates is probably not a good thing for many humans. Returning to the idea of thyroid, specifically, here's another study showing that in 6 healthy males with 11 days of 3 diets, all having the same amount of calories, and differing amounts of carbohydrate, specifically 85, 44, and 2% carbohydrates. So in this study, there were healthy males who had 11 days of 3 different diets based on their carbohydrate levels, 85% as carbohydrates, 44% as carbohydrates, and 2% as carbohydrates. And what they found was that all of these diets were isocaloric, but in the lowest level of carbohydrates, what they found was in the men who had levels of carbohydrates at 2% in their diet, there was increased protein catabolism, that is increased breakdown of protein, and lowering of the hormone T3. So very clear in this study that low carbohydrate diets increased protein catabolism and lowered thyroid hormones like T3.
I didn't catch the duration of that study, but again, the blood level itself is not the final arbiter or indicator of how the body is doing.
It's also been noted repeatedly in exercise studies in men that giving carbohydrates improves free testosterone and decreases cortisol after intensive exercise training. Here's a study showing an example of that. And in those who are exercising or doing intense exercise of any kind, carbohydrate clearly improves the attenuation of the immune system after those exercises.
Yeah, so it's kind of out of my bailiwick to talk about exercise. I refer to Professor Tim Noakes of Cape Town, South Africa, the work he's doing, and Professor Jeff Volek at Ohio State. They're studying people who don't eat carbohydrates and they do exercise, and basically they're finding a new normal range. The higher LDL levels among those who exercise was kind of curious, and so the metabolism is different. But now let's just step back. Let's say someone has exercised with carbs their whole life, and you're now putting them on a diet that doesn't have carbohydrate. Of course, it's a change from their whole life. So, it might even be that this individual, the runner, is adapted just perfectly to run on carbohydrates. Well, that would be great. and fine, eat carbohydrates. But I don't see here, so 6 people, and there's still a lot of, how should I say, signal or cases, anecdotes, case series. There's a lot of anecdotes of people who thrive and do well without eating carbohydrates, especially if they're reversing metabolic issues like this. And so these are just kind of really small things that I don't think are very big detractors. Let me know your thoughts down below.
As you can see here in this study very clearly, the authors say consuming carbohydrate but not glutamine or other amino acids during exercise attenuates the rise in stress hormones, meaning that the stress hormones went up less, such as cortisol, and appears to limit the degree of exercise-induced immunosuppression, at least for non-fatiguing bouts of exercise. So I think it's pretty clear that when it comes to ketogenic diets and exercise performance, there is a benefit to having carbohydrates. When it comes to ketogenic diets and thyroid hormone status, there's a benefit to having carbohydrates. When it comes to ketogenic diets and electrolyte levels, there's a benefit to having carbohydrates in your diet. And when it comes to ketogenic diets and sex hormones like testosterone or free testosterone index, there is a benefit to having carbohydrates in your diet.
Well, the last kind of tirade against keto diets, whose ketogenic diet are you talking about? There's a big distance between the ketogenic diet for epilepsy for children and the ketogenic diet that's being used for reversal of diabetes. So you have to know that difference. Many doctors, many dietitians, many nurses who've been in the hospital know about that for epilepsy and think that that's what we're talking about. That's not what we're talking about. It's a ketogenic diet, but it's not the ketogenic diet for epilepsy. The first phase of Atkins is ketogenic, is induction of Atkins, first phase of South Beach. The End Your Carb Confusion, phase 1, in my book, is a ketogenic diet, but it has real foods in it. It's not arguing that you have to have a certain percentage of fat to make sure that it works. In fact, my approach doesn't even need you to measure the ketone level, and it will still work. So whose keto diet are we talking about? I can for sure tell you there aren't studies, even with 6 people, for checking the thyroid of the 20 different kinds of keto diets that are out there. So anyway, so I'm underwhelmed with the data here that say keto diets are bad or we're unhealthy or will kill you. As Jeff Volek told me in a Q&A session at a recent meeting, it reminded me Professor Volek at Ohio State said there's never been a study that showed that a ketogenic diet, properly formulated ketogenic diet, is harmful. And these kinds of short-term things, remember that metaphor of what would happen if you started an exercise program. You're going to be sore, it takes you a while to get into it. That may be what's reflected here in the short-term changes. So more research, of course, would be great. You don't have to wait for that because you can get your own markers and your own blood tests checked. So you don't have to be looking at a study of 6 people that's out there and doesn't apply to you. Well, I hope you find this helpful and that you like it. Please like, subscribe, ring the notification bell, and look for content on Wednesdays and Fridays. If you enjoyed this video, consider joining our YouTube membership for early access and exclusive live Q&As with me. Just click the Join button below or support us with a PayPal in the description.